Hello, I'm Barbara. I'm a widow in my 70s, and I have pretty challenging shoulder and hip problems. And I happened to see the advertisement of Regen America in my local newspaper and decided to go to the seminar. The seminar was very thoroughly presented. I learned a lot. It was very encouraging in terms of following through and making an appointment at the local location near where I live. I met with a physician's assistant. He looked at my MRI for my shoulder, sent me off for more updated blood tests, and also an x-ray of my hip. I came back and met with him again, and we went over all the questions I had, like, where is a local hospital in case there's an emergency and they hit my spine when they're harvesting bone marrow, and it's only an hour or a mile and a half away. The day of the procedure, I met with Dr. Boyle, who explained the entire procedure to me. I went into the room where the procedure was being done, and I felt it was a very sterile environment. That was important to me, and all along the way, Dr. Boyle and his assistant and the nurse explained to me every step of the procedure. It was a very strange feeling to have the bone marrow harvested. They anesthetized the area, so I didn't really see or feel much of the very fine-tuned piece of equipment that went in to harvest the bone marrow. They then actually inserted the bone marrow into my hip. They told me that my hip was the worst of the patients they've seen, except they had a man whose hip was as bad as mine. And then they inserted the bone marrow into my right groin area and my shoulder. The needle pricks hurt a bit, but it's certainly tolerable, and sort of like when you're having your blood taken. The next morning, I had a fair amount of pain in the insertion area for my hip, but I didn't get over to get the Tylenol, which is the only medication you're allowed to have, and it dissipated each day. After the third day, I didn't even feel it. I had some strange sensations in my shoulder. However, that could be due to the condition of my shoulder. And that disappeared, I'd say, after 5 or possibly 6 days. And I feel fine right now, and I feel very confident about having had this procedure. Where I went to have it done, they were very thorough, very friendly, and even if it somehow doesn't work due to the condition of my particular body, I'm glad I did it, because I think it was a risk well worth taking, and I don't have to rely on family who are very willing to help me to drive me around for the 6 weeks that I would have after I had hip or shoulder replacement. So I would highly recommend researching this on your own and making your own decision. But I'm really glad I did it, and it was minimally painful. So good luck.